Hello viewers, today we are going to know about several details about health. Now all of us agree that health is wealth, because even if we have everything else in this world but still health is not there, then we will not be able to enjoy anything that we have with us. So health is a very important component and a requirement for all of us. If health is not well, we cannot concentrate on anything, we cannot enjoy anything, and usually illness has lot of pain in component, and because of that pain that is involved in any kind of illness, we are not able to concentrate on any activities, and we will not be able to enjoy anything in our life. So having a good health is very important aspect. Now health psychologists did lots of research trying to understand what is health in the first place, and also they tried to develop many theories explaining health behavior outcomes. So first, to define health, health is multidimensional. It is no longer just an absence of disease. World Health Organization defines that health is a state of physical, mental and social well-being. Today, they also include spiritual well-being as an important component of health, and it is not merely an absence of disease. The later trends in health psychology indicate that health is much more than just social and cultural and physical components. According to them, environment also plays a very important role. So they call it the socio-ecological model. According to this, environmental factors have a lot of impact on health, and so the current definition of health includes such varied concepts such as the person's ability to cope with the changing environmental conditions, the person's ability to aspire for goals, and also the person's capacity to fulfill needs. And even later understandings or later research of health indicates that there is even a political component that is involved in health behavior and health outcomes. For example, we can take our midday meals program that is initiated by a government. Because of this political decision that is taken by the government, today we can see that there are many children who are able to have healthy life. So like that, there are many programs because of this political changes all over the world that are influencing health behavior, and also the concept of health is also gradually changing. In this, let us explore what are the different concepts of health. There are two important concepts of health that are put forth by health psychologists. The first one is taxonomy of diseases. Please look at slide to understand the several components that are involved in this, what they call a systematic taxonomy of disease. According to this, there are three major components. As you can see, the first one is impairment. Impairment refers to changes in the individual's body, like any loss or abnormality because of psychological or physiological or anatomical reasons. And this impairment leads to functional limitation and activity restrictions, which are considered as the second component of the taxonomy of diseases model, and you can see both these come as the second component called disability. Disability refers to changes in what the individual can do and cannot do. This in fact results in the third component, what they called as the handicap, and handicap refers to changes in the individual's relationship with physical and social environment. So according to this theory, there are many determinants of health, and health includes so many factors. and different theories basing on their postulates, they try to understand the health, and basing on that only they try to develop intervention techniques to help people overcome health and also to help in the prevention and control of disease. Going on to the second one, that is called the Epidemiological Triangle of Health. This epidemiological triangle of disease lists three factors: the agent, host and environment. And as you can see in this figure, they are listed in the three angles of the triangle. And according to them, this epidemiological triangle portrays the interaction between this host, agent and environment. Now, what is this agent? Agent can be any chemical or biological causative factor, and the host are factors which might be genetic or acquired. And the last one, the environmental factors, can be biological, social, physical or any other factors that are directly related to the environment. So, these two models to some extent explain the various concepts of health. Now, after looking into the concept of health, let us see what are the determinants of health, that is what components make up to form health. There are many determinants of health. For example, age is a determinant of health. All of us know that as we grow old, the health problems that we have to face keep on increasing. During infancy also there will be many health problems, but once childhood and adolescence sets in, the person's body matures, and for a relatively long period of time till old age, many of the individuals enjoy health. So, age is a very important determinant of health, and almost in 80% of the cases we can predict that the older the person is, the more illness the person is going to suffer. Of course, this is an exception in the case of people who are born with some genetic conditions. For them, because of their nature of the disease, they continue to suffer from all kinds of illness, beginning from infancy, it continues to childhood and also into adolescence. For example, say the case of juvenile diabetes. This will strike as early as 5 years of age or even earlier, and these people continue to suffer all throughout their life, and most probably if their diabetic condition is not controlled, then they are going to also prematurely die. So, age is certainly an important determinant of health. Now, other determinants of health include the kind of socio-economic status that the person enjoys, especially the income levels. Now, it has been found out consistently that people of lower socio-economic status suffer from many disorders compared or diseases, especially all communicable diseases compared with people of the high socio-economic level. But research, especially modern research, has found that the people belonging to higher socio-economic status are also suffering from illnesses today. But they identified that there is a difference in the kind of illness that they suffer from. For example, it is shown that people belonging to high socio-economic status, they have diseases such as coronary heart disease and diabetes, but whereas people belonging to a lower socio-economic status, they are the ones who suffer from especially illnesses like tuberculosis and many other kind of communicable diseases. So, today although the economic condition is a direct determinant of health, but we cannot say that people of higher socio-economic status enjoy health. But in one sense, yes, they can enjoy their health provided they follow the right lifestyle. But when we talk about low socioeconomic status individuals, they cannot afford to have the right kind of lifestyle. So, in this way the socioeconomic status certainly is a determinant of health, and gender is also found to be a determinant of health, and it is the research results have shown that women tend to have lot of chronic problems compared to men who seem to be having more of acute illnesses. And women, because of their physical and biological makeup, tend to be suffering for a longer period of time because of their particular physical condition. So, the kind of diseases that women are afflicted with are certainly different from the kind of diseases or illnesses that men undergo. It is found that coronary heart disease is especially higher in men compared with women, and women tend to be suffering more with pain associated disorders like especially lower back pain and spondylitis today. So, the gender is a determinant of health, especially when it comes to the kind of illness that one is afflicted with. Other determinants of health include the geographical location, for example, where this person is staying. Is a person staying in a country and in a neighborhood that is neat and clean and free from pollutants? Or is a person residing just near a chemical factory? Certainly, people who reside near pollutants and are continuously exposed to these hazardous wastes coming out of the several industries, they are the ones who are going to be afflicted with illness sooner and also suffer from a variety of them, compared with people who are living in neat and clean neighborhoods. Other determinants of health, of course, are the lifestyle choices. Those people who are stress prone, especially type A behaviors, they are the ones who are found to be afflicted with lot of illnesses and diseases. People with exercise filled, diet conscious lifestyle are the ones who are found to be leading healthier lives. So, lifestyle is another important determinant of health, more so in the present day situation. Now, genetic factors are another important determinants of health which we cannot neglect, because certainly genetic condition is a predisposition for them to become ill. If the environmental factors are also supportive for that kind of disease or disorder to erupt, certainly these people will be afflicted. For example, those who are prone for cancer. If this person who is prone for cancer, or there are many other family members who died of cancer, if this person is cautious and leads a healthy lifestyle, then the person may not be really affected by it. Because of that genetic predisposition, if the person, say for example, is a smoker, then certainly the genetic has a role to play in the kind of illness that is going to be afflicted. So, genetic makeup is also an important determinant of health, and other important determinants are the kind of cultural and community influences that ones have, and also the kind of work that the person does. Persons who are in high risk jobs, especially who have to take lot of risk, who work outdoors and who have to frequently travel, and those who are in high stress conditions, and they are the ones who are going to have a lot of illnesses compared to another person who has a very stress free kind of work condition. So, the work environment and the job also is a determinant of health. Education is certainly another determinant of health. People who are educated, especially who have some idea about the causative factors of disease, who have knowledge about the various disease conditions and also what kind of precautionary measures that they have to take so that they will be safeguarded are ones who are less prone to diseases and disorders compared with the uneducated. Another important determinant of health is again the access that one has to health services. So, we know that during infancy the children have to be given lot of attention, lot of health care has to be given, and they have to take so many vaccinations. So, if they do not have access to these health services, then all throughout their life, at any point of their life, they can be susceptible to the various diseases. And access to health service also includes the distance that is involved for them to go and take some health support or service when required. If suppose they are staying in a forlorn place which is far away from the regular services and hospital facilities, certainly the time that elapses from the moment of the onset of the disease till the onset of the treatment program is certainly going to have an impact on the length of the disease. So, the people who have access to health care services are found to be less prone to diseases and enjoy health. And today another important thing that is involved in this aspect is that the medical professionals, they recommend regular checkups so that any probable disease can be prevented. So, having regular checkups as regular as once in 6 months, say for visiting a dentist or for having any kind of examination. So, access to health facilities is an important determinant. There are other determinants of health that are not directly related to the individual, but are more related to the society at large, like the political situation of the country that they are residing in, the kind of political programs that are there, and also the environmental factors that are involved. If suppose they are staying in a place which has lot of hazardous waste, and also if there is lot of urbanization, and so the density of population is more in their place of residence, then naturally once the density of population increases, there is a demand for important resources, and also the quality of air also tends to have an change because of the overcrowding. And other factors also include the country in which they are residing and the policies that that country adopts. For example, in India we have the polio campaign. So, we can it is almost guaranteed that for the last 4 or 5 years, many of the children, even those infants who belong to interior villages, are given polio vaccination, unlike some other underdeveloped or low economic country. So, the place of residence, especially with reference to the country, also has an impact as a determinant of health. Now, summarizing all these various determinants, we have a nice model that is developed by health psychologists. Please have a look at, in this slide you can see all these factors that we have discussed, or all these determinants that we have discussed in as a graphical representation. In this you can see that individual lifestyle factors, demographic variables like age, sex and other important factors are the basic core of this figure. Coming to that, after that, social and community networks are an important determinant for health, and in this social and community networks you have such varied determinants like agriculture and food production, education, the work environment, and also conditions of unemployment, the water and sanitation that is available to them, and also healthcare services and even housing is found to be an determinant of health. Now, these come under the general socio-economic, cultural and environmental conditions for health. Another important theory which helps us to understand the various determinants of health and the interrelationships of these various determinants with one another is the Lalandi document. It is called as the health field concept, and please have a look at slide. It is the various determinants or components of health are listed here, and you can see that there are majorly 4 components. The first one is human biology, and the second one is environment, third is healthcare organization, and the last one is lifestyle behaviors and risk factors. Human biology is a component which involves such factors as some of them we have already discussed: the genetic makeup of the person, the physical condition of the person, that is basing on the kind of diet that the person takes, the maturation and aging levels of the person. The maturation, if it happens and all the at the right time and all the developmental milestones are achieved, then only health is guaranteed. If suppose a child does not achieve the developmental milestones as per norms, then that is certainly going to have an impact on the kind of health that the individual will enjoy in life to come. And other biological factors can be susceptibility to diseases. Now, there will be some individuals who have some weakness in their organs. For example, some people will be ones who easily catch cold, but some other people will be ones who are easily prone to accidents, and there will be some other people who are very healthy when it comes to changing weather conditions. They are not affected by coughs or colds, but these people suffer from various pains and aches in the body like leg pains and back pains. Now, what are the reasons for these discrepancies or differences? It is certainly the biological makeup of the person. So, according to this model, human biology contributes to about 10 to 15% of health status. The second one is the environment, and according to this 20 to 25% is contributed by environment towards health status. Now, environment can be divided into physical environment as well as social environment. In physical environment, our access to healthy water, access to clean air and also access to healthy diet, all these come under physical environment, and also the safety and security that one has and the type of housing that one lives in, all that are an indicative factors for health, and they come under the physical environment. Now, coming to social environment as a determinant of health, lot of research has been undertaken by health psychologists, and in Scotland a series of experiments have been conducted where researchers collected information from the different socio-economic background individuals. So, in their analysis, they found an alarming result. According to them, they hypothesized that people of low socio-economic status are the ones who will be suffering from many illnesses and also long-term illnesses. But interestingly or surprisingly, they found that people of the high socio-economic status are also suffering from so many diseases and disorders. This was a surprising finding to the health psychologists. So, from this Scotland findings, they had concluded that different socio-economic status individuals suffer from different kind of diseases, because although they found that the high socioeconomic status individuals suffer from diseases, they found that there is a difference between the kind of disease that the affluent are afflicted with. So, social determinant of health is the indicative here regarding the kind of job that the person has, the kind of work and stress that is involved. Other important social determinants of health are the kind of employment situation in the country that is prevailing. They found that those countries with high unemployment rates have also more prevalence of various kinds of illnesses, which suggests that if the people are in good employment and continuous employment, naturally they will be less stress prone, unlike people if they are in a state of unemployment. And incidentally, we can note that unemployment rates are on the rise globally. So, globally we can predict that there will be more illnesses and more diseases today. Apart from that, the kind of social support that the person has is also an important determinant of health. You might have seen some cases where even though the person is suffering from, say, an acute condition, a serious illness, if that person has lot of social support, they surprise even the doctors, because they rebound and they come back to normal life. The doctors might predict that the person might eventually die, but many times people with lot of social support, family support, friends support, and also the kind of access that they have to health programs, these are the ones who even though they are afflicted with illness, they rebound quickly, and also the severity also is lesser. So, social support is another important social determinant of health. So, another very important determinant of health, as you can see in the diagram, is lifestyle. It contributes to nearly 50 to 60% of health status. So, what does these results indicate? They mean that even though biologically a person is predisposed to a health condition, and even if the environmental resources are not so conducive for health, and even if the person does not have enough social support, still if the person maintains a healthy lifestyle, then they are going to stay healthy. So, lifestyle changes are a very important component of today health programs. Having a good lifestyle means having regular eating habits, regular sleep habits, then doing lot of exercise, and being conscious about the diet that one eats, and also trying to take lot of greens and take less of cholesterol rich foods and so on. So, in this context, the adopting of exercise regimes like yoga, meditation, and other naturopathic programs are highly recommended today by scientists and physicians. So, to summarize, we have seen in this lesson the various definitions of health, and we have also seen that health is not just an absence of disease, but it is a comprehensive well-being in all fronts like physical, social, mental, and even spiritual. Apart from that, we have also seen the various determinants of health, and among all the determinants of health that we have discussed, we have found that lifestyle is a very important determinant of health, and that is a very interesting and it is a good news, because if suppose biological or other factors are important, then we will not be able to do much, but lifestyle is certainly in our hands. So, we can conclude that health is very much in our hands today. Thank you.